When you're walking into a clinic or hospital, the first person you see is a nurse. He or she checks your vitals, writes it down, and then leads you to a room. They may ask if you are taking any medications or have any issues the doctor should know about. A few minutes pass by. The doctor comes in. They address your issues and then leave. Which did you spend the most time with, a doctor or nurse? Today I will inform you of the differences between the workload of nurses and doctors. From doing extensive research, I am qualified to speak on this topic. I will do this by informing you of nurses provide the majority of direct patient care, that nurses have a heavier day-to-day workload, doctors have different responsibilities that are equally demanding, and that it is difficult to determine who works more. Many people believe nurses do the most work, which brings me to my first point. Nurses provide the majority of direct patient care. According to Why Are Nurses Important in Healthcare, the role of nurses explained. Admin states nurses check patients' vitals, continuously monitor their conditions throughout the day and or night, and they chart and record the patient's health. Statistics by the previous source states that most, if not all, of patients' interactions with any healthcare provider are roughly 86% spent with nurses. In addition to nurses providing the majority of direct patient care, brings me to my second point. Nurses do have a heavier day-to-day workload. Nurses tend to work long hours. Many nurses work 12-hour shifts throughout the week. According to nurse.org's news article, 74% of nurses are emotionally exhausted. Burnout study by Joyce University explains that most nurses are chronically overworked, malnourished because of the lack of time to take breaks, and reconsidering their career choices. According to AJN Off the Charts blog of the American Journal Nursing, Jenna Colelli, a registered nurse in Wellington Regional Medical Center, explains that she became a charge nurse in a new cardiovascular ICU, and that it became overwhelming because of a surgeon I didn't see eye to eye with, moral and ethical dilemmas in patient care, staffing challenges, and a hostile work environment. Although nurses endure long, hard hours of constant patient care, doctors also go through many difficult and tasking things, which brings me to my third point. Doctors have different responsibilities that are equally demanding. Doctors have many responsibilities and a high workload as well. According to Atlantic International University, key roles and responsibilities of doctors include diagnosis and treatment, preventative care, management of chronic conditions, emergency care, patient education, and research and innovation. Not only do doctors have many responsibilities, but they also undergo severe physical and emotional pressure. According to Charlton Health, doctors go through long hours of stress, emotional tolls, administrative burdens, and rapid medical advancements. Both nurses and doctors endure hardships within their jobs, leading me to my last point. It is difficult to determine whether a nurse or doctor does more work, as they are both equally important in healthcare. Imagine walking in to an emergency room and you're examining the room. When you look around, you see nurses moving around to different rooms to check on their patients, and doctors examining and following up with the patients and their families. The point is that healthcare needs nurses as much as it needs doctors, and vice versa. Doctors and nurses work hand in hand. According to the National Library of Medicine, it explains that physicians and nurses collaborate to make sure they're delivering high-quality patient care, improving overall health of patients, and putting their roles and responsibilities together to resolve difficult issues and make quick, life-saving decisions. In hospitals, although nurses may be with you longer than doctors, the doctors are working behind the scenes to come up with plans to treat you diligently. Overall, I have informed you of how nurses provide majority of direct patient care, how nurses have a heavier day-to-day workload, that doctors have different responsibilities that are equally demanding, and that it is difficult to determine who works more between the two. This speech informed you about the differences between the workload and responsibilities of doctors and nurses. When you walk out of your next doctor's appointment, remember the question I asked you in the beginning. Who did you spend the most time with? Whether your answer is the nurse or doctor, hopefully you'll also remember that healthcare isn't about who does the most work. It's about two professions combining their knowledge and skills to give patients the best possible care.